morning.
Again. Good morning.
We messed up our first one because Round thought that it was 6 o'clock in the morning when really it's 7:40.
But we wake up at 6 o'clock in the morning. That was it.
Yeah, I woke up at 6, and Zola is down for her first nap of the day here. Today, we're just gonna chat about the differences between pregnancy and birth in the Netherlands compared to in America. Now,
we did a little bit, we start in America.
Yeah, so the first 20 weeks of my pregnancy, I was in America with no expectation. I didn't know that we didn't know we were moving here. So I got like all the information that I wanted, like tour of the hospital, all of the like facts about like what you're allowed, what you're not allowed, what to expect. My sister-in-law also had a baby exactly a week after me, and so I just chatted with her yesterday to remind me of some differences, some big differences, because we were chatting the whole time. We're like, did you have to do this? Do you have to do this? Do you want to, like, how was this? Comparing them, and it was definitely a lot different. So we're gonna break it up into like 4 different parts. So I'm gonna say the pregnancy, the actual birth, the post-birth care, and then the costs will be the final.
Yeah, but the cost we don't know exactly.
Yeah, I haven't gotten, because I didn't actually give birth in America. I don't have an exact bill, but I have like a few different estimates of what it costs, and I know exactly how much my like deductible was in America. So yeah, we'll talk about it. Now, for pregnancy here, the biggest difference is that it's just like a lot less medical in the Netherlands. It's like you go to a midwife. You don't go to a doctor unless, like a gynecologist, unless there's like actually something like wrong or they need to check. I actually got both experiences. I had my normal midwife, and then I also went to the gynecologist because she was like small for gestational age. She's just a small baby. She's still small. So our midwife, the midwife, that's the difference in America, is that in America, the gynecologist can do the ultrasounds for you, can do everything. But here, the midwife is just your midwife. Like, go to the echo place to get echoes done, or ultrasounds. You go to the lab to go get lab work done. So it's not all like you go to the doctor and they do everything. When you go to the doctor, that is the truth. Like when I went to the gynecologist, I got my ultrasound, went to the doctor, and got the labs done all in the same building, all in the hospital. That's one big difference, is just like the medicalness in America. My sister-in-law, she wanted a midwife, but it's not an option. She had a midwife for her first pregnancy, but her insurance didn't even cover it at all. It's like not nearly as common to have a midwife. It's definitely an elective thing.
I have a feeling that here it's more calm, and there it's way more. They give you more stress. They give you stress when you go to a hospital.
Yeah.
They give you stress.
Right.
You don't go to the hospital that you have the same feelings when you go to a mall and buy some clothes.
Yeah. No, that's true. I mean,
here you like it when you go to the midwife. You like to go.
Yeah.
What you like to hear what happened. Is she growing? You will hear the heartbeat and everything. And when you go to the hospital, you have also a feeling from okay.
Yeah, it's like something's wrong. Yeah, that's
It's already
true.
the smell of the hospital.
Yeah.
Especially in America, the smell. So I have the feeling that I visit my grandfather. It's so smell.
Well, there's a lot of old people there normally.
Yeah.
Oh, in America also, there's a lot of tests that are like mandatory or like don't feel elective. Like you have to get your glucose test, a strep B test, like just all the tests. And here, they don't do either of those. They don't do a strep B test unless you've had reoccurring infections. They don't do a glucose test unless you like have symptoms of gestational diabetes. And I think that it was funny because I asked for both of them. I was like, but why do they do it in America? Like it must be important that they test everyone for it. But they said, well, if you can take a glucose test, but if you don't have symptoms, even if you have gestational diabetes, we don't do anything for it. So if you don't have the symptoms, even if you have it, it doesn't matter.
Yeah.
And with the strep B test, in America, if you have strep B, they give you antibiotics no matter what during birth, if you have it. Yeah. Here they do not. They only give you antibiotics if you're having symptoms, even if like during birth. They want to prevent things a lot more
But I
there
think that
than
is
here.
also
They're
not
like
good for the baby.
right.
Well, that's also not for
Giving them antibiotics without the requirement of
then I
it.
have the feeling that make your baby weak, but I'm not a doctor. Like I am a trainer, and I like it when you do everything with real food.
Yeah.
And not with all the things what you see now with all the whey protein and this and that, and everybody is here. They use how you call it, a pre-workout.
Yeah. Yeah, definitely it's easier.
But that's also what I feel from when you go to the hospital and they said, okay, we do this, we do that before we know something.
Yeah.
And I think, yeah, for what?
Yeah.
You do it for the money or you do it for the child?
Yeah.
The baby.
Yeah. Yeah, we don't need to test it because, well.
But maybe I say now a lot of things, but I'm not a doctor. That's my feeling. Right.
Yes, these are all of our own personal experiences and feelings, not actual medical advice. No. I was kind of, it's hard for me to say, but like I was kind of in the middle there. I felt like I should be getting these tests because I was thinking like, what if there is something wrong and I just don't know it? Or what if I have strep B and it causes an issue, but I just don't know it because they didn't test me? So I was kind of in the middle where I was like, I kind of want to get tested. Yeah. So you'd think like it's the benefit of like, oh, you don't have all these tests, but like, I don't know, it kind of stressed me out a little bit.
Follow your feeling.
Yeah. Also here, after 38 weeks, normally like you have to go to the doctor or the midwife every week once you're that far into your pregnancy. Midwife comes to your house to check you after 38 weeks, which I thought was super nice.
Yeah, but that is this midwife come to your house, huh?
Oh, not all of them.
No, I think you have also that you go to them. She was super chill.
Oh. Okay.
So you have midwife, they come to your house.
Yeah.
And we have lucky that we live, that's for her a 3-minute walk.
Yeah, but she goes to everyone's house.
Yeah, okay, but that is her, I think that is her...
Her practice.
Yeah,
Okay, I guess that's also true is that it's not as standard here. There's not as much standardization as in America. Like, in America, everyone pretty much has the similar experience, I feel like.
Yeah.
But here, I guess it can vary a lot.
And then what I have also, when you go here to a midwife, then you go to a kind of mom. You know, she has some mom feeling.
Yeah.
And when you go in America, that I go to the hospital, but I go to the doctor.
Yeah. Yeah, but
that's
and that's how it
different
is.
Feeling.
Yeah, here when I was going to the gynecologist, I was there for I think 6 weeks. I was under their care. I had to go every other week and get scans to make sure that she was growing according to her own curve.
Here
in the hospital, here
yeah.
in the Netherlands, and that definitely felt a lot more like in America. Like it's very like they're doctors, like they're definitely doctors. They 100% agree with science. Like they're very much more science. Like you should get all of these things. Like you should.
Yeah, but you have when you go to a doctor, then you sit there and then you have doctor language.
Yeah.
Here you have when you talk from how you feel, good, and it's like a chat.
Yeah. Right. Yeah, with the midwife.
The only thing what you miss is coffee.
Yeah. Well, you can have coffee when you're pregnant. In America, they're much more like follow the books, but here, at least, well, my midwife, she was a little bit more doesn't follow the rules. Like very much more like,
No, she was more. She followed the rules. Everybody followed the rules, but she was more from nature.
Yeah, that's true. Like when I went right before I went to the midwife or to the hospital, I was told that I should get the injection for the whooping cough, that I can get it so that it helps the baby like when she's born. So it's in her when she's born. And I asked my midwife, and I was like, should I get it? Like, is it important? Like, what are your feelings on it? And she was like, you don't need it. But then at the gynecologist, I asked there too, and he was like, no, definitely get it. So there was definitely she's definitely more home birth natural, and the gynecologist was definitely more like, no, like it's recommended for you to get it, so you should get it.
Yeah, but they don't talk shit about each other.
So yeah, that was pregnancy, and birth was is definitely different here. For giving birth, a lot of people have home births here. I think it's like 30% of the population has a home birth.
How many percent is that in the US then?
I think it's like 2% in America. So it was, definitely much more common here.
When you calculate that, it's the same amount of people.
Yeah. 30% of the Dutch population and 2%, Yeah. So, home births are definitely more common. I was planning to have a home water birth, and I had everything set up, but I ended up having to be induced at 42 weeks, so that was not able to happen, unfortunately. But it is common to have a home birth. The birthing situation there in the hospital, I feel like is, I don't know, in America they make, like, I don't know if it's social media or what, but they make it seem like it is like you have to like force the doctors to do what you want. Like you have to be a very big advocate for yourself. But here, if I say something or want something, they're like, okay, like it's my choice for anything that I want. There's like no pushback.
But they call it also the birth hotel here.
Yeah. There's no pushback or anything. Even I had wanted a home birth, and that was known because that was my plan.
Yeah.
And then I got to the hospital, and I was there for a few hours, and I was like, it's not gonna give me a medical birth anyways. I might as well get an epidural. I actually got an epidural because I was extremely nauseous, and I am not good with nausea, and so I thought maybe an epidural would help it. And so I ended up getting an epidural, but when I said I wanted it, they didn't say anything other than, are you sure? Because that's very different than what your like actual plan was. Like, so are you really sure?
That they did it.
Right, rather
it's
than...
It's not, okay, here you have the shot.
Right, yeah. They're like, are you really, like, do you really want it? And I said, yeah. Like, I really do now.
But that's also so they like it when you follow your plan.
Right.
Your plan.
Rather than being like, oh, like you're in pain right now, so you want it right now. Where like, is that actually really what you want? But also here, epidurals are not nearly as common. Lots and lots of women do it naturally, even in the hospital. Lots of women. Even beforehand, I was like, in America, it's like, you're crazy if you don't want an epidural. But here they're like, you don't need an epidural. I think every single person I talked to before the birth, they were like, you don't need it. You're built for it. Like, you're supposed to be able to have a baby. Yes, it's painful, but you can do it. Like, very much more encouraging.
Strong people, you're not.
Yeah, the mentality here is definitely much more like, you're a woman. You're built to do it. Even though I say that now, and I'm like, I needed medicine to even get her out.
But you can see that in the birth video.
Yeah. We have my birth video is posted.
There you see that.
I'll link
how
that.
you call that? Peak, and then you feel nothing.
Yeah.
I filmed that.
Oh yeah.
Then you go to
I had
80 or something.
Yeah, a contraction. I was super heavy, and I was already under an epidural, so I didn't feel it. No, I just felt like some pressure. But the epidural is, I think it's different here. Well, it is different. So in America, the reason I really didn't want an epidural was because there's a lot of time there's fentanyl in it in America. Here, before I got it, I had asked, and there is no fentanyl or narcotics in it. So I think that's one of the biggest differences, is that it is really just an anesthetic medicine rather than like a whole drug. When I talked to my sister-in-law, she said, she was so groggy, so out of it, like doesn't even really remember much after the epidural. But for me, like, I was just numb. I didn't feel any other symptoms other than like my legs were kind of asleep.
Yeah, I look at it.
Yeah,
it was a needle like this.
Yeah.
And then they go with some string in it, so in the needle, that was the...
the tube.
Yeah.
But here they have two people check the epidural to like make sure that both, like, it is actually placed correctly and that there's no like risk. So it's just kind of like I check you, you check me kind of a thing.
Yeah.
That was
cool to see, huh?
Yeah, they were explaining him all the details of it, which was kind of cool.
Yeah.
Because he was all fascinated in it.
Yeah. It said go super fast though. When it was in, then you feel after a couple minutes.
I felt, I think, 2 more contractions after that, and then nothing else. I could still feel my legs a little bit, like I could lift them maybe like this much off the ground, like off the bed, but it wasn't super easy. It was like my legs were just super, super heavy, but I didn't feel any pain, just pressure. Also with the epidural, they stop it when you're like after I hit 10 centimeters and they stop the epidural. So that, and then they tell me just to let them know when I feel like I'm ready to push. So they let the epidural stop so that I can feel my own body and feel when I'm ready to push and feel how I'm actually pushing, which I thought was kind of cool. I say that because, well, it was still painful then while I was pushing, but I liked that more than like I knew
think it's
how
less
to
painful
push.
than without.
Yeah, of course. Yeah,
But it was
I still was relatively numb. I definitely could feel it.
Yeah.
But I think that's also better because a lot of times in America they say like, yeah, you can't feel anything, so like you don't even know how to push, or yeah, you tear a lot more with an epidural there because you don't know how hard you're pushing, so sometimes you'll push too hard. Yeah, but here I felt it, and they were very good at guiding me and breathing. They were very hands off. They even, like, I didn't really know how it all worked, of course, and she told me while she, like, her head was out, she said, look, and I said, look down, and then I was like, I don't know what to do now, and she goes, grab her, so I grabbed her.
Yeah, and then they stop, when they stop, when it was like this.
Yeah. I thought that it was like you push her out, once the head's out, she's out. No, okay, I pushed her out, her head was out. Half of her head was out to here.
Yeah.
And they said, okay, don't push. I said, don't push! It hurts. It really hurts, for sure. And I was sitting there like, okay, when can I push? When can I push?
Yeah.
And then...
But at the moment, it goes super fast.
It didn't feel fast for me. It felt like a solid 7 minutes while I was waiting there. I only actually had to push for 12 minutes, so it was actually really fast. They give you... an hour of skin to skin directly after birth. They don't do any checks. They don't do anything. It's just skin to skin for the first hour. The cord in America, I know that my doctor would not do more than 1 minute delayed cord clamping, because I had mentioned, I said I want to do delayed cord clamping. And they're like, oh yeah, we do that 1 minute. Like 1 minute is the max that you can do. Here, they do it until all of the blood is out of the placenta into the baby.
Yeah.
So until the cord goes white. So I think mine was probably 10-15 minutes of her still being attached to the cord. And that was actually, I couldn't breastfeed right away because the cord was too short and the placenta was still inside. I hadn't delivered the placenta yet.
Yeah.
So she kind of couldn't go up high enough to...
But she was chill.
Oh yeah, she was super chill. And she cried for a second and then...
Yeah, but did she need to cry?
Yeah. I was watching the video back and she didn't cry very immediately. She didn't cry until she was already on me for a second.
Yeah.
The placenta, they don't really, in America there's like options. You can keep the placenta, you can donate it, you can do different things. Here, I don't know, they just said, do you want it? I said, what am I going to do with it?
Spaghetti.
Yeah, but they don't do any banking or donations here like they do, or at least at my hospital they did not. What else about the birth? They're very, just hands off. Oh yeah, normally you can go home after like 3 hours.
Yeah, and you need to have a kid seat.
Yeah, a baby stool. That's the same
with
thing.
With a marker on it. Well, how you call this, a sticker. That he is
certified,
yeah.
like certification. Yeah. In America it's the same, but yeah, we can go home here after 3 hours normally. Normally in America you have to, especially if you get an epidural, you have to stay 24 hours. Here that's not the case. You can leave after 3 hours. We ended up having to stay again because she was too small.
Yeah.
And they really emphasized that she was too small here, and I don't know if it's just because like the Dutch are really used to big people and big babies. That she was just small.
They test the sugar though.
They just tested her glucose every 3 hours to make sure that she didn't have any sugar dips, and that she was fine. She was fine. She was perfectly fine the whole time. But I mean, better safe than sorry. Double check that I didn't miss anything for at the birth. Oh, induction. They do not do an induction at 38 weeks or 39 weeks like they do in America. They do inductions after 41 weeks. So at 41 weeks, you can choose to have an induction. Like at 42 weeks, you have to have an induction. Well, I guess you don't have to, but they really recommend you need one at 42 weeks. But yeah, in America, you can get it before 40 weeks, and that is not common here. Also, water births are pretty common here. My midwife specifically was like very pro water birth. She loved doing water births. I guess I've been talking a lot about my midwife. My midwife was great, but she actually didn't birth my baby. Since I went to the hospital, because I had to do the induction, it becomes a medical birth. And
but
so,
she came up to us.
Yeah, she came to say hello. But yeah, the midwives at the hospital actually birthed my baby, but it was still midwives. It wasn't a gynecologist. A gynecologist only does it if there's like an actual like medical emergency or medical issue.
Yeah.
But yeah, there was no medical issue. I just needed Pitocin and needed to be induced. So yeah.
And you know who's coming? I don't know how it is in America. So we met her already before.
Oh yeah. There, but that's similar. Like you've met your doctors, but I was actually. I've heard a lot of times like there's a lot of people in the room in America. Like my sister-in-law, she's like there was like 6 people in there. There was the gynecologist, 3 nurses, some other there's all these kind of things. But for me, I had my midwife, my nurse who was telling me how to breathe,
And we have also one student.
and one student. But
she was already she go to doctor. You know, the younger.
Yeah, but she wasn't there during the birth. She was just in and out of the room during the labor.
Because that was her shift.
Right. Yeah.
But she was also super nice.
Yeah, but like during the actual birth, it was just my midwife, my nurse, and another nurse. But the other nurse was basically our photographer. She just took pictures the whole time.
Yeah.
So that was nice.
Yeah.
But yeah, it was very calming and very chill in there. Now, post birth was. Oh. No, I forgot one other thing. The hospital bag. I don't know if it's social media or what, but in America, hospital bag. In America, they tell you to bring your entire life to the hospital. Like every single, you need slippers, you need this, you need like literally everything. And here I asked them what I should bring, and they said, an outfit for you, an outfit for baby. That's it.
Where was the outfit for the baby?
Yeah, I forgot Zola's coat. But that's one thing that I wish I had listened to the American way, because there was things like they in America they're like, bring your peri bottle, bring this and this and this. I think here, since normally you go home right away, you don't need all of it, but I did end up having to stay. And so I wish I had more stuff, like slippers to walk to the bathroom. I don't want to put my shoes on every time I walk to the bathroom, but the floors are really cold and kind of gross to walk in the bathroom without shoes on. But just like, I don't know,
Gross,
like your own.
That's how that they clean it.
Yeah, of course, but I just like still feel yucky walking into a bathroom without shoes on.
No, but now it sounds like that
No, it's very clean, but yeah, or like what's some other things? Yeah, slippers with
it's so nice when you
your
stay
own
24
blanket.
hours that you have your own thing.
Yeah. No, I wish I had my own blanket during the labor. Yeah. So I think the American way would have been better for that, for sure, was bringing my whole house into the hospital with me.
Yeah.
Okay, now, post-birth. The biggest thing is that you get a nurse or a, what do you call it? Kramzorg?
Kramzorg,
Yeah. That comes to your house every day for the first 9 days after you give birth. And
she do everything.
Yeah. They do everything for you. They do checks for me to make sure, well, I had stitches, so to make sure that, like, everything is good down there.
She do everything.
She checks for the baby. She does her weight. She'll show you how to bathe her. She makes sure that, like, she'll check her belly button, checks everything to make sure that she's doing good.
She make food for us.
No, she didn't.
Breakfast.
That was your other one. He has 2 other kids. So he has a little more experience with them. His other Kramzorg, I think, did a lot more than our Kramzorg. Our Kramzorg was...
Yeah, but because he said
good.
from, you don't need to do this, you don't need to do that,
yeah.
you can go early back home.
Yeah.
Normally they stay, what was it, 52 hours or something?
42, I think. 40 to 42 hours.
But yeah, we said after 4 hours and on the day from, okay, it's nice,
yeah,
bye.
you can leave, yeah. But she did the laundry, she cleaned the floors.
She
Super
chatted
nice.
a lot.
She chatted a lot. She was a chatterbox. But yeah, it was, I mean, and she does like things like, I personally, like, I was a nanny and I've taken care of plenty of kids, so I had a lot of experience. I didn't really need much help or guidance, but she had a lot of information that, like, would be very helpful if you're a new mom and have never taken care of a baby or have no idea what you're doing. That would be very helpful. Like, she can literally teach you anything you want, like how to hold the baby correctly, how to feed the baby. She also will help with feeding her. She checked sometimes to make sure Zola's latch was good. Just really anything and everything you need. Your midwife.
She was also so from natural things.
Yeah. Well, because she knew that I was.
Yeah, but she was also like that.
Yeah, she gave us a lot of recommendations.
A boy, she have.
She gave us a lot of recommendations for like different products, like the vitamins that we were gonna give her because I wanted things as natural as possible. So she gave us recommendations for like even baby oil, stuff like that don't have perfumes or anything in them. Yeah. So that was very helpful. Yeah, she was great. Yeah. And the midwife comes to your house, or at least mine did, three times to check on me to make sure that I was doing good.
Yeah, but that's always.
Oh, okay.
Yeah.
A lot of people come in and out of your house. They also don't do a hearing test at the hospital like they do in America. Here, they do a hearing test. They come to your house and do the hearing test in your house. They do the healed blood test in your house. Another person comes to do that. So while it is all great, that I think I would prefer them coming to you rather than you have to packing up the baby and going. It is kind of a lot. I felt very overwhelmed. Like I couldn't really ever take a nap because I'm like, well, when's this person coming? They're gonna, like the doorbell's gonna ring any minute. And so there was definitely a lot of people in and out of the house. So that was a little bit kind of not chaotic because everyone comes in is very calm, it's very cool.
But we said to each other, okay, I'm happy that now when everything.
Yeah, when everyone was gone, it was like, okay, that's nice. There's no more people coming into the house.
Yeah. But on the other side, it's also good that they do all the checks.
Yeah, of course. But in America, I think they do the blood test, the hearing test, and everything all in the hospital when they are born. And so I guess that I honestly probably would have rather that. Getting it done all at the hospital while we're there. And then your 4-week check, they also come to the house. And then after that, you go to the doctor. Or you go, like, for all the vaccines and the rest of the stuff, you go into...
What do you call that? Where you go?
Consultation bureau?
Oh, yeah.
Yeah, there is where you get, like, vaccinations, and they check their weight and their height and everything. So you still don't even go to a pediatrician. You never really go to a pediatrician unless there's like an issue. We had to go to a pediatrician because, again, Zola was small. And they were like, yeah, she's fine. You don't have to come anymore.
But she was perfect.
Yeah. Now, my sister-in-law just texted me and she had said, wow, that's actually a lot less than I had thought. We can move on now to the costs in America. Her bill before.
Is it not in the basic in America? Okay, let's say you have an insurance there, and you are pregnant and you birth and everything. Is that you need to start a different insurance when you are pregnant, or it's gewoon in the basic?
Yeah. Every insurance is different there, but yeah, it depends on like what percentage they cover or whatever. But she said her birth was actually $12,000. Which is honestly lower than a lot of quotes that I've seen. She ended up having to pay after insurance $2,800 with $2,800 with insurance for the birth. And since I was there for the first 20 weeks, I actually have quite a few bills as well from America. My first appointment was $189. This is all without insurance. $189. My second appointment was $619. And my third appointment was $1,805. And those are all, it was for my 20-week scan and my checkups before that, and then my first appointment. Now, that is not how much I paid. I ended up only paying $584 out of that. So that kind of gives you just a little bit of a rough
I think
estimate.
here,
Without
here
insurance,
in Holland,
it's
you
normal.
pay nothing for these three things.
Yeah, no. So in Holland, everything is different. My midwife, all of the appointments and the deliveries was would have been 1,000 without insurance. Would have been €1,000 for every one of my appointments and my delivery.
Yeah, but without insurance doesn't exist. Yeah, only for you because of you are out from outside the Netherlands, but everybody in Holland
Right.
have an insurance.
Yeah, but I'm gonna first explain without insurance and then with insurance.
Oh.
Okay. So $1,000 without, like, for all the appointments and the delivery, and it was actually kind of hard to figure out the numbers at first, like when we first got here, because they don't experience people without insurance because everyone has to have insurance. I just didn't have my visa yet, so I didn't have insurance. And so they were like, yeah, like, we're gonna have to figure that out. Even at the hospital, they were like, I don't know.
Yeah.
But so in the hospital for the birth was $700 to give birth in the hospital with your own midwife, or you had to pay $3,000 deposit to have the hospital staff. And then you get refunded whatever money you didn't use. Say you didn't get an epidural, you didn't get things that would have cost you up to the $3,000. So it's like $3,000 max is how much it's going to cost, and then you get a refund for whatever you didn't use.
Yeah, but that was when everything go right. When something go wrong, then you need to pay more or not.
No.
Oh, that was it. That's the max.
Yeah, $3,000 was the max.
Okay.
That's how much birth costs in the Netherlands. Like, that's how much it can cost. And then for the gynecology care at the hospital, it's $1,000 for the care at the hospital.
By the way, it's euros.
Oh, yeah. Oh! Sola's awake. She's just staring at the ceiling. It always scares me when she does that. She doesn't even make any noise, but she normally will go back to sleep. She just wakes up between her little sleep cycles. But anyways, that's all. So total, the most expensive birth you could have here would be $4,000. $1,000 for the medical care, the pre-birth care, and $3,000 for the hospital. That's the most expensive it would be here, and for me, it would have been without insurance. With insurance, you have a $385 deductible, and that's it. That's all you pay.
Yeah.
So $385 for birth and all care that's involved in it. Everything else is completely 100% covered. So I ended up getting insurance.
That's only when you have a wife from here. That's not how it goes with us. We pay also.
Yeah, because I didn't have insurance for the first part of my pregnancy. But the birth, I did have insurance, so we didn't have to. Yeah. We ended up paying more. But we still paid less than we would have paid in America.
Yeah, and we are still busy to get the money back because we think that the hospital, but it is not that we think that, but the hospital make a mistake.
Yeah.
But we pay a deposit.
Yeah.
And I asked them, okay, but I like to pay every appointment.
Right.
Because of I'm busy with
to get insurance.
Yeah, and the insurance company said already from okay, everything is okay, but we need to give us a week that we fix everything because of with the IND and everything. Dus I told that by the hospital, and they said no, you need to pay a deposit, but when you pay a deposit and your insurance is fixed, then we pay it back. But now they make I don't know how you call it, it's a kind of number that, how you call it, do you know that? The number, you know, that when we go, you pay and deposit because you have a kind of medical thing.
Yeah.
Yeah, and then they make that number, and now they can change it anymore. There's now I lose maybe my deposit, but I'm still busy with the hospital to
right,
get the money
because they can't
back.
change it to a to an insured policy.
Yeah. Dus now I pay what was it, €1,000?
Yeah.
No, yeah, and the 395.
Yeah.
Dus the 1,395.
Yeah.
The 395 they give me that already back.
Yeah.
And then I pay $999, but I'm also busy with that because of you have one appointment in the $999 that was without your insurance.
Yeah, and then the rest of them
was
were
in
with
the insurance.
Yeah.
Yeah. Dus
but they're saying since it started before my insurance that none of the appointments are covered by insurance.
But that is our thing. That is not how it works normally, but that's what we have. Dus
that's definitely not
maybe
the
I
normal.
make it now a little bit hard.
Yeah.
But that's our experience at this moment.
Yeah.
Normally you pay 385, or depends on what you have. You have here 385 or 550 or 800 something.
Yeah, you pay less on your insurance, and then your deductible is a little higher. But the most high deductible here is $800. In America, my deductible was $6,000. So after my birth, I would have had to pay $6,000 at the end of the day in America. So even if we ended up having to pay the extra $1,000 here, well, still a lot cheaper than it would have been in America.
Yeah.
Pricing here is definitely more affordable and definitely easier. Also, insurance is so much easier here. Like, you go to the hospital, you give them your name, and your insurance, they have it because your name is attached to your insurance is attached to your name. Like, they are very much more, like, you have a digital ID that has your insurance, it has your,
everything, your tax, everything.
Yeah, everything. Yeah.
On that.
And so it's all connected. And
you
so
see also my speed tickets.
Really?
Yeah, that's also on there. My certification, what I have.
Your driver's license and stuff.
No, but also when I go to school and I finish my school, that's on there.
Really?
Yeah, everything is on there. That's your digital ID.
Yeah.
That's it. Yeah, everything is on there. Yeah.
Wow. Yeah, that's cool. So it's all definitely.
But that's why it was now so hard to get an insurance for her, because of it's not hard to get an insurance. We can get an insurance directly when she came in. Then you have a kind of expat insurance.
Yeah.
But in the past you have an insurance with birth, but a lot of people outside the Netherlands use the Netherlands for
to have a baby.
To have a baby, and then you have people from outside the Netherlands, they come to the Netherlands in the last maybe, I don't know how many months or weeks, and then they get an insurance, and then you pay 100, at that moment, maybe 100, let's say 125 euros, and then you have your own deductible from 300, that was that time maybe 325, and then they pay that, then they have a baby, and then after that they move back to their own country and they stop the insurance, and now... Yeah. And that is a couple years ago they stopped that.
Yeah, so now even if I would have gotten the insurance.
Yeah, just now you can get an insurance for you. That was the 85 euros. Mm-hmm. And then you are insured for...
everything.
Yeah,
except
everything.
for birth.
Yeah, that's it.
Children are insured for free until they're 18, and this includes all dental, everything. Insurance here is also reasonably priced. Mine's $150 and yours is $140.
Yeah.
Yeah. So,
but that is also what America was. They are in the time from Obama. Mm-hmm. He was also busy with a kind of system like that.
Yeah, much more like everyone has to have medical insurance, and it has to be affordable.
Yeah.
Because
like we here, and not only here, you have more countries here. They have the same system, but we pay insurance for somebody else. Dus you pay for each other. Want we have only 18 million people here in this country, but then you have 18 million times this, and then they have money, and then when I have an accident, I use the money in the deposit.
Well, but I think that the biggest difference is that there are set prices for things. Like in America, every hospital, they're all private, so the government has nothing to say with how much you charge. So they can say your birth costs $30,000 or your birth can cost $12,000. It doesn't. There is no set standard. But here, they're like, this is the cost of a birth. This is the cost of.
Yeah, but I don't say now that Holland is so everything is here better than in the US. That's not what I like to say.
We pay a whole lot more in taxes. That's for sure.
Yeah, we work. Everybody here work for the tax office. Yeah. That's how I see it here. Yeah. But when they ask me from what kind of work you do, I can also say I work for the tax office. Oh, okay. And the same as you, and the same as you, and you. Yeah.
Yes, we pay what.
Okay, when you work hard here, they punish you also hard.
Yeah. No, you just pay higher taxes.
Yeah. But it's also
everywhere you pay higher taxes.
Fixed.
Yeah, the roads are perfect.
Yeah, it's not you don't see a hole in the road, that kind of things.
Yeah.
But everywhere you have something.
Yeah, the hospitals
now
are
I
great.
think I'm a little bit negative because I'm a little bit done here.
He's
now
sick of
already.
all the high taxes.
Yeah, but then maybe when you go to another country, then
There's something everywhere.
Yeah.
No country is perfect. Nothing is ever. This was really just to compare the two countries, America and the Netherlands, and birth. Birth here is definitely a very different experience. The costs are different. The way the care is very different. But yeah. I don't know if I would. There are a few things that I was like, yeah, this is better. But I think there are a lot of things that in America I would have liked.
My experience, the difference between when I live in the States and here is that when I have something and I need to go to the hospital, I go to the hospital without that you have a scary feeling. In the US, I thought from, yeah, fuck it, I don't do that. Want maybe I have a bill for a couple $1,000.
Right. Yeah, here it's very nice that you, like, it's very upfront. Like, even with us, like, we had to pay before we even went to the hospital. They're like, this is how much you have to pay. And so there's no surprises. Like, I gave birth 3 months ago, and I had my 20-week appointment. So I had, like, what are we saying? 9 months ago, I went to the last hospital in America. I still have not received the final bill from that appointment. Like, Zola had a huge rash on her face, and I was afraid. But, like, in America, I probably wouldn't have gone to the doctor because, I mean...
Like here, is it not possible that you are a parent of a child, and when your child have something, that your child go to the hospital, and the hospital make you bankrupt?
Yeah.
That's not possible.
Yeah.
But I hear stories in the US, and I see people on the street.
Yeah.
They live on the street because of something like that.
Yeah.
And that is not how it works here. I don't know exactly the stories.
Yeah.
How it works, but it's a little bit.
Medical bills are scary in America, but here it's not something you have to worry about. You go to the doctor because you need to go to the doctor, rather than in America. A lot of people don't go to the doctor until they're seriously sick because they don't want to pay for it. It's expensive there, and it's unknown. I think that's a lot of the thing is, like, it's unknown. They do one extra test and it could be $600 extra. Like, you don't know, but here,
you know the test that I did, the test that
for genetic. We got a genetic test because I'm a carrier of a disease, and I wanted to make sure he wasn't before we had a baby.
Yeah, and the test was how many? 500?
Yeah, 600 and something.
Yeah, here's nothing.
Yeah.
It's for free.
Yeah, and even with insurance, it wasn't an insured test because it's not something that you need to do. Genetic testing. Anyways, it looks like she is awake and rolling around, so we're gonna go and take care of our child. Here, let me go get her for you.
Hey, there's our baby.
Good morning. Hi, sweet girl. Hi.
Hey. No, you are never so happy when I wake you up like that.
No, she's always happy when I wake her like this. No. Oh, that for this little thing. No, thank you so much for watching, and I hope this was helpful. If you have any more questions that you think that I may be able to answer, leave them down below, and I'll try to get back to you. Thanks for watching.